Okay, so I'm going to present preoperative epicrisis. So, top case of oncology, breast cancer. So, before any pre-operation, we should have consent to surgery. So, this is uh, the example of consent to surgery. So, the patient has to sign this form so that the patient can undergo surgery. So the patient date of surgery is on the 14th of November 2023. We have the social data. So the diagnosis of the patient is malignant breast tumor. The type of surgery is absolute because the patient feel pain and discomfort, but it is not life threatening. However, it will cause if it is not removed. So the planned surgery is partial breastectomy, and the planned anesthesia is combined paravertebral block and general anesthesia. So the risk of bleeding for breastectomy is moderate because we are going to do the operation not clear close to the subclavian axillary and brachial artery according to the planned incision. And the risk of thromboembolic complication is moderately raised because patient has a history of hypotension, and this raises the risk of deep vein thrombosis. So the risk of the overall surgery is moderate and there is no contraindication. So pre-operative checklist, it is done on 11 o'clock. The date is 14th of November. The name is Mila. Her vital sign is 36.5 temperature. Pulse is 90. Respiratory rate is 21. And her blood pressure is 120/90. The patient is not allergic. The patient has no communication problems. And the last food and liquid consumed is 7 o'clock. Premeditation is given at 10:30. So ID has been present. The urine has been passed before medication. Yes. There's loose teeth, no crown and bridges, no. Dentures are removed. Hearing aids are removed. Contact lens are removed. His skin is been prepared. Jewelries have been removed. Valuables has is stored correctly. Cosmetic and clothing removed. Theatre patient has worn the theatre gown. Consent form is signed. Operation site is marked. And case of patient is noted. Radiograph we have, and now the checklist is complete. And this checklist is signed by the ward nurse and the theatre staff. Now after that, the patient is moved to the operation theatre to have operated partial breastectomy. So at 11:30, the aseptic procedure has been started. Now, thank you.